Hello, welcome everyone. It is my pleasure and privilege today to introduce our today's keynote speaker, Dr. Agnes Quisumbing. Agnes is one of the first scholars who have highlighted the crucial role and inclusion of women in development. Through her research, she has illuminated how empowering women and addressing gender inequalities in households can lead to more prosperous and resilient communities. Agnes has completed her PhD from the University of Philippines, and she has worked at Yale University and the World Bank before joining the International Food Policy Research Institute, IFPRI, where she now is a senior research fellow. She has published over 100 articles, which has been cited by over tens of thousands of scholars. And she has been one of the co-developed authors of the Women's Empowerment and Agriculture Index, which has influenced lots of scholars in the recent decades. Today, she will present her work on gender, assets, empowerment, and resilience. And just to note before welcoming you that you have inspired me through the journey of my research, and I'm sure she has inspired many of you here. So please join me for a great welcome to Agnes.
Thank you so much for the kind introduction. I'm a bit intimidated to be in this room in this university, which has so many distinguished people on the walls outside, mostly men, but some women too. So distinguished guests, organizers, colleagues, and partners in striving for security and peace. I'm really grateful to Fragile Lives for giving me the opportunity to reflect on many themes that I have pursued over the years. And this wouldn't have been possible without my colleagues at IFPRI, as well as the support of the CGIAR research initiatives on gender equality and on fragility, conflict, and migration. So many of the ideas here are not mine. They draw on the work of hundreds and thousands. So I'm going to start by showing you a passage from my colleagues, Katrina Kozlek and Jo Swinen's chapter in the Global Food Policy Report on Rethinking Food Crisis Responses. And their main point here is that the impacts of crisis are not gender neutral. Women are disproportionately harmed because of barriers that limit their resilience and ability to respond effectively. Shocks reduce women's access to food and dietary diversity. And these vulnerabilities stem from women's already limited access to resources, technology, and services, which are then intensified by shocks and crises. So the impacts of crisis are not gender neutral, which means that the solutions should also not be gender neutral. So in this keynote, I'm going to present three bodies of work. My analogy for here is that this is like a concerto in three movements. Be happy that I am not going to play it for you, but I will just give you a research overview instead. So the first part reviews evidence that crises affect men and women differently based on research in Bangladesh and Uganda. The second movement goes deeper into exploring the effectiveness of potential solutions to avoid crises by examining impacts on women's empowerment and gender equality. And we do this using validated measures of empowerment that we co-developed with our research team and partners from all over the world. And I look at a specific instance where we use this measure to evaluate the effectiveness of an integrated agriculture, nutrition, and gender intervention in promoting resilience in Bangladesh. Finally, we apply the Reach, Benefit, Empower, and Transform framework to assess how we can improve anticipatory action for women in Nepal and Nigeria. And my colleague, Jordan Kyle, is here. She was responsible for a lot of the research design that went into this, so she will answer the difficult questions. So the existing evidence, so let's go first to the first part, is that neither vulnerability to risk nor the capacity to cope with shocks is equal among genders. And I will show this in the slides that follow. Asset disposal is often used to smooth consumption. And because assets are very important in determining empowerment, if women's assets are disposed of first, then it has long-term implications on their bargaining power within the household. So the questions that we're going to explore after that initial presentation of the data is whether a gender and nutrition-sensitive agricultural development program can enhance agency empowerment and build resilience. And we have evidence from an impact evaluation of the Agriculture, Nutrition, and Gender Linkages Project in Bangladesh, also known as ANGEL, and its medium-term follow-up after COVID. The more exploratory question is, to what extent do current anticipatory action efforts reach, benefit, and empower women and transform gender and power relations? And I will present indicative findings from qualitative work in Nepal and Nigeria on anticipatory action programming in flood-prone communities. Okay. So in the first part of this talk, I will focus on assets, showing that men's and women's assets respond differently to shocks, but whose assets are most affected differs by context. However, in the two contexts that I examine, women's assets are less protected, which has implications for bargaining power and empowerment and for the design of social protection systems. So this collage of pictures shows you that assets take many forms and that they are what families invest in to hold wealth, especially in the absence of well-developed financial systems. And different assets can be held by men, women, and also jointly, and this varies across cultures. So why do we want to look at this? Why do we want to look at how men's and women's assets change over time? Well, there's general evidence that risk isn't pooled within households, and that risk perceptions may also differ between men and women. So there's a very rich academic literature on this. And there's already a lot of empirical evidence which rejects the unitary model of the households in many countries, and specifically for Bangladesh. So in the unitary model, individuals have the same preferences and they pool resources. But unlike in the unitary model, the collective model shows or posits that individuals do not share the same preferences and that resources are not pooled within the household. So I spent a large part of the early part of my career testing household models, and we very convincingly reject the unitary model. Social norms favoring female seclusion often lead women to be systematically excluded from labor markets, although that is changing. Of course, everything is changing because gender is socially determined, so it can change. And anthropological evidence from a number of countries suggests that men and women have different asset accumulation strategies and use their assets in different ways to cope with shocks. So the research questions I try to address are whether asset dynamics are different for joint and exclusively held assets, how these differ for household assets, and whether the impact of negative events are different for husband, wife, and jointly owned assets. And these, of course, reflect cultural differences in the concepts of marriage, the definition of assets, and the jointness of assets. We draw on the theory of dynamic poverty traps, which was developed by Barrett and Carter. It's based on observations. It's easier to measure assets and consumption, expenditure, and income. And in the work that precedes what I'm going to show, we use parametric and non-parametric methods to derive a dynamic asset frontier, showing the relationship between household asset holdings in two periods. I'm not going to go into that, but what I will show you is a bit about the survey design and data, and also some descriptives which I think will bring across the story more effectively than looking at the estimated equations. So this is one of the survey villages that we visited in Bangladesh, and the other side is our study site in Uganda, where you'll see was part of an impact evaluation. So the Bangladesh panel study was surveyed in 2007 and 2010 as part of the Chronic Poverty Research Center Poverty Transition Study. So if there are people from CPRC or its descendants here, thank you for that support. The Uganda study was a panel study which was an impact evaluation of the orange sweet potato reaching end user impact evaluation. In both countries, the baseline was in 2007 and followed up after the food price crisis. The data were very gender disaggregated. Ownership categories were joint husband and wife assets. And because we were interested in inter-household dynamics, across time, we limited the sample to intact and monogamous couples. So basically, couples that stayed together between the two panel rounds. And we estimated coefficient of shocks both covariate and idiosyncratic on asset categories by type of ownership. So what's clear here is that assets have grown over time, but there are clear gender differences in asset ownership. Men own more assets than women. And even if they do increase over time, there is quite a difference in the rates at which the household assets are increasing. What's interesting, though, is that there's quite a difference between the sort of the patterns of asset ownership across countries. In Bangladesh, joint assets are more important, followed by husband's assets and then wife's assets. In Uganda, husband's assets are more important than joint than wife's assets. Now, in both countries, different types of assets are held individually and jointly. So in Bangladesh, joint assets, which are the red or orange colored part of the bar, account for most of the assets owned by households in 2010. With the exception is land, which is mostly owned by the husband. And this, if you use a microscope, maybe you can see the tiny sliver of land which is owned by the wife. The share of wife's asset is really small, except for jewelry. In Uganda, on the other hand, the husband, sort of the middle part of the bar, holds a major share of assets. But while the wife has a smaller share, it is still bigger than the share that the wife holds in Bangladesh. So we use these data to look at the impacts of shocks on men's, women's, and joint assets. The stereotype, of course, which is that floods are very common in Bangladesh and droughts are common in Uganda, and we do see this. So we use the estimated coefficients. You can look at the paper to see details about that, to see the predicted change in assets as a proportion of baseline holdings. What's really shocking here, and we did not anticipate this, is that wife's assets would be so severely affected by illness shocks. So shocks, if there's somebody who gets sick within the household, wife's assets are disposed of first. The pattern in Uganda is a bit different, but still shows a big impact on wife's assets, the orange bars, as well as joint assets in the case of a food price shock. The impact of the flood on men's land seems to be better understood. We don't actually know what's going on there, but death also takes a toll on men's land. So the takeaway here is that shocks appear to have different impacts on assets depending on who owns the assets and depending on the context. In Bangladesh, households that experienced a food price shock protected jointly held land and assets, but not individually owned assets, which is a rational response because they want to protect their livelihoods. But you see here that illness shocks really affect women's assets. And this is partly because women tend to hold small assets that can be more easily disposed of, like small livestock and jewelry. In Uganda, households experiencing a food price shock protected husbands' assets, but not wives' or jointly held assets. So I will end the first movement by saying that it was very difficult for us to publish this paper. People were looking for causality, and since this was observational data, it's like, whatever, right? How do you know that what's causing what? It was eventually published, and there are resources at the end of the PowerPoint. But we sort of I moved on to other things. In other words, fortunately, many years later, I started working on measuring women's empowerment. So this is the second movement, and I'm so glad that Naila Kabir is here because this was really inspired by her work. So here I'm going to talk about the development of empowerment metrics and how we use them to evaluate the impacts of agricultural development projects. So I'm going to focus on one project, the Agriculture, Nutrition, and Gender Linkages, or ANGEL project in Bangladesh. So I'm going to start by saying that to monitor progress to empowerment, we need to define and measure it. So I'm going to introduce the Women's Empowerment Agriculture Index and its variants, and then spend a little bit more time on the impact evaluation of ANGEL. So part of the impetus towards measuring women's empowerment was its elevation to an SDG. It created the demand for better metrics. So following Atkinson, who rationalized measurement in the context of poverty, better metrics can be used to motivate political action, to monitor progress, and to help guide the design of effective policy actions, what works and what doesn't. So while there are many measures of gender equality, like the Global Gender Gap Index, there are fewer measures of empowerment, particularly those that are measured at the individual level. So we follow Nyla's definition in defining empowerment as a process of change that results in an expansion in people's ability to make strategic life choices, especially in a context where this ability was previously denied to them. And Nyla's definition focuses on resources, agency, and achievements. But I'm going to focus on the agency aspect because we already have pretty good metrics for resources and for achievements, but agency was not well measured. Note that assets, however, I think are very important resources that really help to enable agency. So when we developed the Women's Empowerment in Agriculture Index, this was developed by USAID, IFPRI, and OFI in 2012. This measures the inclusion of women in the agricultural sector. It's survey-based. It interviews men and women in the same household. And it was designed to look at decision-making and control over livelihoods, resources, and income, both sole and joint, mostly in agriculture and in population-based surveys. The important thing is that by collecting data on women and men in the same household, we're able to measure gender parity. So WEA is made up of two sub-indices. 90% is taken up by the 5 domains of empowerment, which is a direct measure of women's empowerment in 5 dimensions. And 10% goes to the Gender Parity Index, which is women's achievements relative to her spouse or partner, and all range from 0 to 1, with higher values leading to being interpreted as greater empowerment. Okay, what's actually quite important about the WEA is that it's very similar to the family of indices that are, like the Foster-Greer-Thorbecke indices, which are additive and decomposable. So because they're additive and decomposable, you can look at how each component of the empowerment index contributes to this empowerment. So this graph here shows the cross-country findings from the baseline of the Feed the Future survey, which was fielded to 19 countries. Here, I think we only have 13 countries. But the cross-country finding was that credit, workload, and group memberships are constraints across countries. And the other thing, although this was not meant to track progress over time for countries comparatively, you track with reference to your own country. The baseline findings actually show that Bangladesh had the highest percentage of women who were disempowered. And this actually attracted a lot of policy attention. And it led to the development of the program that I'm going to talk about in a few minutes. Meanwhile, the Women's Empowerment Agriculture Index has been adopted by 258 organizations in 63 countries, starting from the 3 pilot countries of Guatemala, Uganda, and Bangladesh. There are many types of WEA. We have the WEA and AWEA for population-based monitoring. We have the project-level WEA, which was adapted for projects in partnership with 13 agricultural development projects. Actually, with support from GIZ, we developed this index further to go beyond production to market inclusion. And we are now scaling up another metric called Women's for national statistical systems. Now, one of the things that was significant in developing the project-level WEA was that we reached out to 13 agricultural development projects who applied to join the portfolio. So they sort of committed to help us develop or to co-develop a measure of women's empowerment that was suitable for project-level use. And in doing so, they worked with us to examine their strategies, their project strategies, and sort of organically, this framework for looking at empowerment in the context of agricultural development projects emerged. We were not entering this project planning to develop this framework. It emerged from our interactions with our projects. And basically, the idea here is that agricultural development projects have a range of objectives with respect to women. The REACH objective aims to include women in project activities. The benefit objective aims to increase women's well-being, and it requires more than reaching women. More difficult is empowering women, which is to strengthen their ability to make strategic life choices and to put them into action, because you have to increase women's agency, change gender attitudes among participants, and finally, the most difficult of all is to transform, because it goes beyond the woman and her household, to change gender norms and structures on a larger scale. And it goes beyond empowering women. It involves men, changes gender norms at the community and societal levels, addresses structural, systemic, and institutional barriers, mobilizes the power of the collective, and has a commitment to address unequal power relations. So unsurprisingly, among the 13 projects which joined us, and for the 11 for which we were able to finish the impact evaluation, collect end-line data before COVID, a lot of projects actually succeeded in reaching and benefiting women. A smaller proportion empowered them, and even less succeeded in transformational objective. I mean, it's not easy. I mean, I quote from US President John F. Kennedy. So I'm not going to give his Berlin talk. I'm going to give the moon talk, which is like, we go to the moon not because it's easy, but because it is hard. So we try to address women's empowerment or disempowerment in project not because it's easy, but because it is hard. So I'm going to talk about this project, which is the Agriculture, Nutrition, and Gender Linkages Project, which had aims to increase farm incomes, to be scalable, and to be gender sensitive. The key gender sensitive component was that husbands and wives were trained together in agriculture, nutrition, and gender sensitization to break down distinctions between women's activities like child rearing and men's activities like growing crops. So this was actually one of the big innovations in terms of the modality of project delivery. The original study design and resurvey was a cluster randomized controlled trial in rural Bangladesh, where husbands and wives participated in the following treatments: an agricultural production training, which is treatment A, nutrition behavior change communication, BCC, delivered by agricultural extension workers who were mostly male from the Ministry of Agriculture. There was also a nutrition behavior change communication arm, which was delivered by Angel Pushti Kormis, women hired in the community. There was an agriculture nutrition training. There were bundled trainings, agriculture training provided and nutrition. And a third training which had agriculture production, nutrition, and gender together. And there was a control. So the gender sensitization component was based on Helen Keller International's Nurturing Collections curriculum. So because Angel was part of ProWea, it was able to pilot this empowerment metric, which was co-developed with the 13 projects. And I'm just going to show you some a subset of the results, because it's a huge study. So we look at the empowerment score, which is a weighted sum of the 12 ProWea indicators. We look at whether the woman and man are empowered, and we look at gender parity. How much more time do I have? I'm good? Okay. So I'm just going to cut to the chase and give you the results. It was a fun study. It had qualitative work and quantitative work. Nice mixed method study. So what we found is that all treatments have significant impacts on women's empowerment score. So the purple bars are the women's scores, the impact on the women's scores relative to control. Interestingly, only the treatment arm with nutrition was significant for men. And we interpreted this, and when we talked to respondents, they said that it was very unusual for men to be receiving nutrition advice. They actually found it empowering to learn about, what foods are good for your kids. All treatments significantly increased the likelihood of women being empowered. Again, similar to the earlier result, only the treatment arm with nutrition was significant for men. And in terms of which treatments had statistically significant impacts on the likelihood of that the household achieves gender parity, it was only the treatment that combined agriculture and nutrition and the treatment that combined agriculture, nutrition, and gender. So remember this because you will see this theme emerge again later on. So summary results, success, right? It increased both women's and men empowerment, increased prevalence of households achieving gender parity. The increases in magnitudes were statistically meaningful. Quite important for many of our stakeholders is that Angel empowered women without disempowering men, and the treatment arm with nutrition increased both men's scores and empowerment status. There were no unintended impacts on workloads. It didn't increase work burden of women or men. But there was an inconclusive evidence of possible increases in IPV. Now, we didn't have a direct measure of IPV because it wasn't, we could not ethically ask these questions without providing support in case somebody found IPV. So this was really a question about attitudes towards IPV. The result was inconclusive. So let's now remember that in the first part of the talk, I talked about the impact of shocks on households, but that, frankly, when we submitted it to journals, they said, but what's your source of variation? You have no exogenous variation here. Well, we don't believe your results. So we have forever been looking for, wouldn't it be nice to be able to do a follow-up after a shock occurred? Now, you should now really be careful what you wish for. So Typhoon Fanny happened in May 2019, and we plan to go back to the field in early 2020 to follow up Typhoon Fanny. But of course, COVID-19 happened. It's like, we were looking for a covariate shock, but not that covariate and not that horrible. Well, it happened. So our field team was actually about to start interviews when they were all called back because of COVID. So the households were eventually resurveyed in 2022. We didn't have funds to resurvey all treatment arms. So we basically resurveyed only the arms which had agriculture in it. So agriculture, nutrition, and agriculture, nutrition, and gender. And our main questions were whether households exposed to the different treatments more resilient, and were the empowerment gains sustained over time. Our resilient measure was the Livelihood Scoping Strategy Index, which is based on 10 questions. And they were basically, we'd like to ask whether and how often members of your household have to engage in a list of behaviors due to lack of food or lack of money since the start of the coronavirus in March 2020. And we classify this based on a WFP classification into 3 categories: stress, crisis, and emergency. We also had data on consumption, on diets, and on assets, and on empowerment as well. Well, lo and behold, our preliminary results showed that combined training in the diversification of agriculture, production, and nutrition, BCC, with or without gender sensitization, I can never pronounce this properly, sensitization training, had sustainable effects on real per capita consumption, women's empowerment, household asset holdings in 2022, and it built resilience. It basically reduced the need of the use of livelihood coping strategies that were harmful, like asset disposal, when most households were coping with economic consequences of the COVID-19 pandemic, as well as some households who were more affected by Cyclone Fanny. So they were less likely to experience reduction in real per capita consumption and more likely to maintain the gains in consumption and improvements in diet that they had obtained as a result of the Angel intervention. What's important here is that agriculture training alone did not build resilience. It was really important to have the combination of agriculture and nutrition training. whether or not you had gender training, you had sustainable effects on real per capita consumption, women's empowerment, and household asset holdings, and less use of crisis coping strategies. So you might ask, what about, were men and women's assets more affected? Which is a question from the first part. Interestingly, because households didn't really dispose of that many assets, we did not detect any significant impacts on men's or women's assets. So finally, we move into the last movement, which is to use the reach, benefit, and empower and transform framework to improve the effectiveness of anticipatory action for women. So this is the most policy-oriented part of the talk, but also the most preliminary. The paper is being finalized as I speak. So this is work which was done with some students graduate students from George Washington University, and with my colleagues Katrina Kosek, Jordan Kyle, and Emily Myers. And here we use the RBET framework to improve the effectiveness of anticipatory action for women. So many of you here in this room know that anticipatory action is a formal mechanism that enables humanitarian organizations to get ahead of a predictable shock and mitigate its impact by agreeing ahead of time who will receive funding for what and based on which rules and triggers. So basically, actions are taken in advance of a crisis, before either the shock or its peak impact. So a really nice graph that Jordan called my attention to is this graph from OCHA, which shows that in traditional humanitarian assistance, the red line, resources are mobilized after the onset of a crisis. But in anticipatory action programming, early warning signs trigger the release of humanitarian aid even before the shock occurs. Because the shock's anticipated, fewer resources have to be mobilized when the shock finally does occur. So the methodology that we use in our joint research was first a desk review, and then interviews which were conducted by the students in Nepal and Nigeria of government officials, civil society representatives, advocacy organizations, and local researchers. In both Nepal and Nigeria, focus groups with civil society representatives, and in Nepal, focus groups with male and female aid beneficiaries. The security situation in Nigeria prevented the students from actually going to the field, so they held the discussions virtually. I'm almost done. So how do we now apply the reach, benefit, empower, and transform framework to anticipatory action programming? So we sort of slightly redefined objectives, or reinterpret objectives. So the reach objectives really is about how women access anticipatory action. Benefit is how anticipatory action improves women's circumstances. Empower is how AA facilitates women's empowerment, and transform how AA can change gender norms and structures. And what we found here is that the strategies for reaching each of these objectives are really quite different. So under reach, identification of beneficiaries, inclusive information dissemination across multiple modalities, and accessible registration processes and distribution methods are important. In terms of benefit, you have to ensure that aid modalities address women's needs in flood-prone areas, whether this means going from house to house, delivering in cash, delivering food, having dignity kits. It also has to navigate inter-household decision-making, particularly in areas where men are thought of traditionally as controlling all resources that enter the household. And this is true particularly in areas where aid is targeted to women. And to mitigate risks of gender-based violence if targeting aid to women really upsets the inter-household dynamics. In terms of empowering, including women in program design and adding empowerment training into AA programming is very important. Really bringing the community on board. That also creeps over into transform, where you employ gender transformative approaches. You engage men and boys in discussions about changing household norms about resource allocation, advocating for women's inclusion and community-level decision-making, and recognizing existing cultural norms and practices, but leveraging community and religious leaders as agents of change. So putting all this together, we follow a thread. We follow a thread from gender assets empowerment to resilience, which has generated evidence on the gendered impacts of shocks and gender gaps in empowerment. And we have used this research to inspire programs like Angel that have themselves generated evidence on empowerment and resilience. And then we applied the Reach, Benefit, Empower, and Transform framework that was co-developed as a part of developing the empowerment metric to assess how anticipatory actions can be better modified and transformed for women, looking at AA programming in Nepal and Nigeria. So before I end, I really want to thank Fragile Lives for giving me the opportunity to reflect on many years of work at IFPRI, and also to all our sponsors and partners over the years, and our respondents from Bangladesh, Nepal, Nigeria, and Uganda. If you think there are lots of people in the slide, it's because this is really a team effort. So these are resources. Thank you very much.
Thank you very much, Agnes.
You want to sit? Go back? What do you
We can have a seat. I think
Okay.
we have a little bit more time to take questions from the audience. So please do engage. But at least from my side, given the context of the Fragile Lives Conference and the ongoing conflicts and violence in the world, do you think such lessons that we learned in settings like Uganda and Nepal can be applied in very severe humanitarian settings? And to what extent these results, these findings in terms of the impact on gender and women specifically, or do we need to also rethink how different interventions might need to be adapted to fit the context of very fragile and very humanitarian settings?
Thank you for this great question. Is mic on? Yeah. So I was not working in a fragile setting when I did these studies, but I think some of the lessons can still be relevant. For example, there's usually a lot of asset loss as people try to dispose of assets. Are there ways to protect women's assets? Are there ways to prevent gender-based violence from occurring if aid is being targeted to women? So the other thing, though, that I think I learned most sort of from reflecting on this from an anticipatory action point of view, which had not come to me earlier, is how important it is to ensure that in the recovery process, mechanisms are in place for people to rebuild assets and for women to be able to rebuild assets that they can control, that they have security in the control of their assets over time. So we often observe very clearly and very drastically how assets are disposed of, but we don't understand very well how they are rebuilt over time. And I think that's an important part that might go into development assistance in general.
Okay, thank you. We're happy to take any questions. Now is your chance to ask questions. Naila, yeah, please.
I just have a comment and a question. My comment is to your comment. And I wonder, when we talk about fragility, there are forms of fragility that emerge in times of crisis that do not differ that much from normal times. But I think when you're talking about war and conflict, you're talking about a level of disruption that, and during COVID, when we talked to some very poor people in Bangladesh, they said life was normal. These kinds of misfortunes and stresses were what they went through all the time. And COVID was like normal. But the question I had was, training comes up again and again in your discussion. And sometimes it makes the difference, right? Mm-hmm. And I wondered if you've thought about what it was about the training that made the difference.
Thank you, Naila. I forgot to mention, actually, that one of the biggest sources of fragility for women is marital dissolution. And often, because they end up leaving the household, you don't track it. So I think that's something that many of these studies don't capture. But going to your point, what about the training was very important? When when we went back to the households in doing qualitative work, it was very interesting that the men and women both said that it was very important for us as a couple to receive this training together. Because they would leave their household and go to a spot in the community where the trainers were delivering these extension messages. And they said, for one, it was a chance for us to interact outside our domestic, our homestead, and really to discuss new topics that we wouldn't normally talk about. And some of them say it's even like going on a date. Now, I wouldn't think of going to extension event with my husband as a date, but it was so out of the ordinary for them that they thought of it as a date. But the other thing also is that they were exposed to different aspects which were outside their traditional spheres of influence. So men were exposed to nutrition, women were exposed to agriculture. And in fact, in terms of adoption of the new agricultural practices, women adopted more agricultural practices than new agricultural practices than men did. And then I think you cannot discount the gender sensitization training, which also involved community leaders and important people like mothers-in-law in sensitization. So I think it was really a well-designed program, and it drew a lot on the experience of Helen Keller International. Of course, I wouldn't say that you should use the same program everywhere. I think we all know that gender norms are context-specific, and how they mediate the effects of crisis and fragility are also going to be context-specific, so things have to be designed for local realities.
Thank you for the answer. One more question, Dorothee.
Hi. First of all, thank you for the brilliant talk. I just had one thought that I thought would be interesting if you can share your thoughts on mine. So when accounting or when measuring women empowerment, especially in agriculture, and evaluating it innovatively, I feel like there is sometimes a trade-off between empowerment and support. Because, of course, women that are monoparental and leading a household have more autonomous or more margin to take autonomous decisions. But still, they are more vulnerable because they don't receive support. So I see a huge challenge in research to evaluate these indications that we measure correctly.
I completely agree with you. In fact, my colleagues, Cheryl Dawes and Ruth Mines-Dick, have this ongoing research collaboration where I'm also involved in, where we're trying to look at whether it's poverty or patriarchy that is more disempowering. And I think it varies, obviously, from a case-to-case basis, but I do see your point that a woman who is a head of a household may have more autonomy, but she may often have fewer resources. It's not always the case, though, because there's also a lot of heterogeneity in this situation of female-headed households all over the world.
More questions from the... You have to raise your hand so I can see you well. Demir.
Thank you, Agnes. Three observations or questions. One is how these changes are sustainable. In a way, if there is an intervention, we see some positive results. Do you think they sustain over time? Secondly, how these people, especially women, perceive this type of interventions? In what extent culturally they're okay with accepting that females should be empowered? I'm from Central Asia, so I think lately the development institutions' narrative in terms of gender empowerment is being reduced because local communities not accepting them well. So now narrative is about future generations. So it's like gender neutral type of narrative. And lastly, is there any age kind of component in gender empowerment? There is a Kyrgyz saying that the man is the head, but the woman is the neck. So definitely it takes to the neck to mature over time, but it's clear that at the later stages of life, women have more empowerment, which may be hidden, but it's still definitely present. Thank you.
Okay, thank you for your question. So, let me answer the easy question first about sustainability. So, the impact was first assessed actually between 2016 and 2018. So, and then we went back 4 years later in 2022. So, I think we can say that 4 years later, in the medium term, there was sustainable impact. Whether this is going to be sustained even further, well, we have to go back. But I think, in terms of countries which have, I think, succeeded in changing gender norms and changing the way that women interact with society, I think Bangladesh has done pretty well. And I think Naila can say more about that based on her recent book, which is out and open access, by the way. I did not memorize the link, so you can ask her. But your second question about whether women like the idea of empowerment interventions, I think it depends on how you define empowerment. I think all cultures will have their own definition of empowerment. Some concepts of empowerment will be rejected by locals. So, for example, as we were developing ProWea, the project level WEA, we were drawing on some of the theories of agency, and especially the kinds of empowerment like the power within or intrinsic agency, the power to do something, instrumental agency, power with, or collective agency, which came out of Joe Rowland's work. But there was one aspect of empowerment, which is power over, that our respondents, because we did qualitative work in the countries where we developed the ProWea, people rejected power over because they thought it was coercive. And so that's why we don't include it in our measure. I also want to I am Filipino. So I must say that as a Filipina, I initially was a bit suspicious about Western concepts of empowerment. But then when I look at the data, I saw that women were doing just so much work. I mean, Filipino men will not object to their women working outside the home. Like, my wife can work outside, it's fine. As long as the house is clean and the children are fed and my clothes are ironed. So, okay, I think Filipino women need empowerment too. So, I think that it's important for women to define for themselves what empowerment means, but it doesn't mean that we should stop, because I think looking at all sorts of objective measures, there is still an empowerment gap. And I think that refusing to acknowledge this gap and only going for gender-neutral measures is a missed opportunity.
Thank you very much for the answer. Julian? And then we'll have a question there.
Thank you, Agnes, for your wonderful presentation. I had a question about the potential increase in intimate partner violence, which I thought was really interesting. I guess I have two questions. One is if a reduction in IPV was part of the theory of change. So was the program trying to reduce IPV? And was it integrated into the curriculum, a focus on intimate partner violence or GBV? My second question is if you can share any learning with us about, how to monitor in complex environments, how to monitor potential harm through these programs. Thanks.
Thank you for this question. As I mentioned earlier, we couldn't really collect information on a direct experience of IPV, so it was more on attitudes. And we use the DHS module, which talks about under what circumstances is it justified for a husband to beat his wife. And there's a list of, I think, 5. In our case, we use 5 instances. And it was not conclusive. So I'm not going to make anything out of it. In our other studies, though, because we worked with 11 projects in all sorts of contexts, there were cases where women expressed an increased tolerance for IPV as part of, and it was because it was more like, this is a trade-off I have to make to be able to participate in this intervention. And so that's a tough choice. I mean, they see that the intervention is benefiting them in other ways. And so they say, it's okay for for me to sort of to accept this injustice just so I can participate. It's tough. What was your other question? Oh, components of programming, right?
Yes, if it was integrated into the curriculum.
Yes. So it was integrated into the gender sensitization arm which was developed by HKI. Yeah.
There's two more questions here, I guess, and then we'll take those and we can maybe slowly start wrapping up. Thank you.
Yes, thank you. I wanted to ask you if you notice that during the training that the men got that the men reacted better when being trained by men representatives of their local government than women, and if women were more empowered by being trained by women representing from their own culture, and also if there was a difference between local representatives and other countries.
So yeah, we actually have a paper on that. So that part was actually randomized also, whether you're trained by men extension workers or female community members. The answer is that there was no significant difference. Except in the area of gender attitudes. So men were slightly more likely to have improved gender attitudes, improve as in more equitable, if they were trained by a man, and women were more likely to have improved gender attitudes if they were trained by a woman. But this difference is very small. And actually, I think this is very good news because given that the pipeline for agricultural extension workers in South Asia is still very thin in terms of women, if men can be trained to deliver extension advice to women and men, I think that's good.
Thank you. Maybe one more question here.
I want to go back to the issue about when, like in Filipino, men would like, oh, we don't mind if our wife works as long as the house is clean. So now this leads to like whenever you do women empowerment interventions that, okay, it's fine, she can go out and work, but then there's the household to be clean. Mm-hmm. So this could be the unintended consequence of double burden. And so I was wondering if there, I know from my experience from Armenia, so the toughest part of changing gender norms, also from both sides, women and men, is like household work. Mm-hmm. So neither of them want to change that, not even women, which I find ridiculous. But so are there any plans actually to do some type of interventions that would rather target men in terms of like, it's okay to share household burden, household work, or is there anything that, towards that direction to reduce the double burden?
So there are actually quite a number of programs which do that. One of the bigger ones is a methodology which I think IFAD is implementing called the Gender Action Learning System, where they sit down with the household and sort of look at the needs and wants of people within the household, and so they can achieve sort of joint objectives. What was very interesting in one project that was also a part of the project that we evaluated is a joint program for the empowerment of rural women. It has an acronym called JPRUE, which is a little bit unpronounceable. But what is interesting is that they implemented this in Nepal. So Nepal was one of the areas where they implemented it very well. And it appears that men are disempowered because their work burden increased. They were helping out with the kids. And this is the bad thing about quantitative measures without qualitative studies to back up a context. Because when you ask men, so are you really disempowered because you're doing more work in the household? They said, no. We're in fact quite happy to be sharing housework, especially childcare with our wives. So attitudes can change.
Thank you. I'll have one last maybe question or reflection. So many students, university here, this research is, where do you think the next 10, 20 years, what's your wishes where the research should take us to help improve? What do we need still learn to close the research and evidence gaps when it comes to gender empowerment and asset allocation and fragile settings?
So I'll make a bid for something that's, since most people here are with fragile lives and looking at conflict and disaster settings, I would like to see more research, really just following up what really is happening to people on the ground. What are recovery efforts like? Is anticipatory action programming working? I think many of the topics, the themes of this conference are already sort of exploring that frontier in research. My bid would be to look at both women and men, because you cannot really look at gender relations by only looking at one. And I think that's what's often neglected in many studies.
Great. Thank you very much, Agnes, for joining us today, and it was a very pleasure. I have a small gift. Little bit memory from Berlin, chocolate from Berlin. So thank you for joining us here again. Pleasure to have you.